Just to introduce myself, my name is Professor John Ellershaw. I'm Professor of Palliative Medicine at the University of Liverpool, and I work clinically into the University Hospital in Liverpool. I've worked in palliative care through my whole career, with a specific interest around care for the dying. And specifically today, I'll be talking about that interlinkage around volunteering care for the dying. So it's a delight to be here, and thank you to Maggie and the organising team for inviting me. And I hope in the next 20 minutes to share some of my experience over the past, probably starting back in about 2009, when we kind of got involved thinking more about volunteering, particularly in that care of the dying phase, but also extending back a little bit like the end of life programme into those earlier, maybe weeks and months before somebody dies. So this is the kind of overview of the talk for this morning. And I thought it was just interesting to think about volunteering in that bigger context in health and social care, because I think that what we've heard from the volunteers is very interesting, but we know that about 1.7 million adults are volunteering in health and social care. And this is back in 2015, which is before COVID. 87% in social care or in voluntary sector organisations, and particularly in our hospice communities, we have a huge tradition of volunteering in this country. So we do have a huge wealth of experience in this area, and a lot of people in our society work out there as volunteers. The other thing that we need to also acknowledge is that this kind of works two ways. Obviously, there's benefits to the people who are receiving the work of the volunteer, but there is also inherent benefit to the volunteers themselves, increasing their social connections, leading to increased well-being and life satisfaction, a consistent association between volunteering and health, and sometimes as a route back into employment. So there is something this is also a two-way thing, that people get meaning from volunteering as well as delivering the volunteering as well. So I think as a societal engagement and movement, there are huge benefits within this workforce. And I say that I sometimes think the word volunteering diminishes what people are doing. And this just kind of diagrammatically shows some of those relationships about increasing those self-connections, well-being, life satisfaction, and improving people's mental health as well. So I think we need to recognise that within our volunteering workforce out there. So development of care for the dying volunteers in the UK. So I think, I'd like to think that we kind of catalysed some of this thinking, which linked with a European project that I was actually led a support and coordination project called OpCare 9. There are the 9 countries that participated in it. And part of this OpCare 9 work was focused on the care of cancer patients in the last days of life. And one of the work packages, or one of the projects that was in this project, was around volunteers, about service provision, roles, education and training. And very little had been written around volunteering at the end of life in care for the dying. And it was actually when we were visiting having meetings in other countries, that we went actually to Cologne in Germany. And in their palliative care service there, their volunteer coordinator came and talked about the role of volunteers. And she presented to us their volunteer workforce and said that our volunteers are there right to the end of life. They sit with patients in our hospice, and they are a really valued member of the team at that point in time. And that kind of, particularly for the UK colleagues, thought, well, certainly in our hospice, where I was working at that time in Liverpool, when patients went into that dying phase, the volunteers who were volunteering in a hospice where they knew people were dying were kept away from the patient. It was kind of, oh, they're too unwell now, so we don't want you to go in that room because the patient's too unwell. And that was normal practice. And I suppose we never really questioned why we'd done that. And so we went back with that question. And beyond that question, just about hospices, we also thought, well, what about when people are dying in hospitals? We often see people dying alone in hospital, kind of very emotive subject. It's emotive for the staff and the nurses who would like to give more time, but we know cannot be there. So how about thinking about developing a volunteer workforce into a hospital setting to be there for care for the dying? And actually what came out of the OpCare 9 was a study that we did in 2011, funded by Dimbleby and Marie Curie Cancer Care, which was called A Living Community Presence for the Dying. And we developed a training curriculum based on experience in other European countries. We trained volunteers specifically about supporting people in that dying phase. And then we researched the stakeholders, volunteers, staff, and bereaved relatives, and triangulated some of that work. And I think it was quite a challenge to establish this, not because we didn't have people who wanted to volunteer to do it, but to kind of get it into the culture of the organization. But I'm going to tell you a little bit more now about the development of that Care of the Dying Volunteer Service at the Royal Liverpool University Hospital that started back in 2011 and is still working today, 10 years or 11 years later. So the Royal Liverpool Hospital is a large, big hospital in the northwest of England. And our palliative care volunteer service is developed as within the larger volunteering service of the hospital. Provides a presence and companionship to patients who are dying, who have no or few visitors and would otherwise be alone and isolated, and supports families who are unable to visit or those who are emotionally exhausted from their bedside vigil and are in need of a break but are reluctant to leave their relative.
Training has been so powerful, and it's just made us, it probably has brought out in us stuff that we didn't know was there. Speaking for myself, it was the most natural thing to do. I just was very comfortable with it. And I think we're all quite sensitive. I'm quite sensitive person. I think let's do it. But actually, when we went in, it was the most natural, comfortable thing to do. So I think training's been amazing.
So we did have a really in-depth training program running alongside this program. And as we've heard earlier, when you're training people, some people say that was very interesting, but this isn't for me. And that's a good outcome of training, because you don't want people feeling uncomfortable and not feeling that this is something they can do and have the skills to do. And those two of our volunteers, they're reflecting on the training, but also starting to provide that support and care for patients. Importantly, you kind of need to get this into the culture and champion it within organizations. So it links with our trust strategic goals. And here's a quote from a bereaved relative. "I wish I'd been there when he died, but knowing he was not alone helps me now. Thank you for this incredible service."
So I think, yes, it's a service that hopefully will grow. More people will realise that they can do it. Because as we both said at the start of this interview, neither of us was sure that we could do it. But everybody that's done it in our feedbacks has said that they can do it. And I know it sounds terrible, but we enjoy it.
But kind of puts that juxtaposition between caring for somebody who's dying and saying, I enjoy it. But I guess you pick that up about that. And somehow it's quite nice, because this is about normalizing death and dying. And part of our training is not to develop mini healthcare professionals. It's about keeping people grounded as members of society, supporting people in society. We were delighted in 2017 to be awarded the Queen's Award for volunteering as a Lord Lieutenant who came and did a nice presentation. And finally, I want to talk a little bit more about the research and development that we're currently involved in around care for the dying and volunteer services. So we are part of the UK arm of the Live project. It's a 4-year project funded by the EU Commission. And this is part of the work of the International Collaborative for Best Care for the Dying Person, which we may talk a little bit more about in the workshop. But the main aim of the Live project is to make a major impact on a global basis on the experience of dying with people, enabling them to continue to live until they die. So we have researchers and clinicians from 13 different countries that are working within this program. So mainly in Europe, but also New Zealand, Australia, and Argentina. Here's our first planning meeting, which is pre-COVID in Rotterdam. And you can imagine that this whole research program has been hampered with the whole pandemic. But the enormity of the work here in these 13 countries, we represent a population of 319 million. In Europe alone, over 5 million people die each year, and 77% of these deaths need end-of-life care support. So this is a big need within our society and across countries. And perhaps how we care for the dying is perhaps one of the most pressing personal, social, and public health issues of our 21st century. And as you know, the graph for people dying within the UK is going up. There will be more deaths in the next 10 years. So there's going to be increased need for palliative care and end-of-life care supportive services. So there are 3 projects. I'm not going to talk in depth about this. We're kind of in our final year of this project. We don't have results yet, but we're collecting them. But it will include a cohort study around from 10 countries, looking at the understanding and experience of death and dying with over 1,000 patients included. Study around medication management, and the one I'm going to particularly talk about a little bit more about volunteer training program within hospitals. So what we've done within the volunteer study is taken our experience now from the UK and feeding it back into Europe, particularly into these 4 countries where we've been developing end-of-life volunteering services in their hospitals with them. And for that, and what may be interesting for this meeting community, is that we've developed a European core curriculum for training for end-of-life care, particularly around the care for the dying, but that extends back these skills and knowledge back into the weeks and months before dying. So this isn't in the public domain yet, but will be, I hope, by the middle of next year. We're still refining it. But I think this is, I think, a helpful document to have, and we'll help circulate that perhaps through SVP program when it becomes available. So linked with that curriculum, we developed an international training program around for volunteer coordinators. And we started publishing, and this is an article that we have published about how we started to develop that European core curriculum for hospital end-of-life care volunteers. So in as much as we're saying this end-of-life care volunteering, we see it important, we hear the volunteers telling us about it, we need to evaluate and research what's going on here so we can use that information to help develop, refine further what we're doing. So part of this volunteer study and what we'll be researching are patients in the intervention group who've had the volunteer in a control group, and we hope to learn from that, but also qualitative interviews with patients around volunteer services, qualitative interview with healthcare professionals and volunteers themselves about delivering it in these 5 countries. So hopefully we may have an opportunity when we have our next meeting to feedback some of these results from the volunteer study. So I think, I hope I've given you a bit of an overview there, work in the past 10 years and work that's ongoing, looking to support and develop volunteer services around care of the dying and end-of-life care. And I'll just leave you finally with this quote from one of our volunteers. I could see that he was dying, so I gently took hold of his hand and told him he was not alone as he took his last breaths. And that's, I think, what we all passionately believe in and what we want to happen for our society, for our family, I guess, for ourselves in that dying phase. Thank you very much.